meninges. I repeat, with the presence of the BBB, the brain, including the meninges surrounding the brain, is kind of separated from the host immunity. And therefore, if any organism finds its way into such areas, then the opposition is limited. Nothing is there to stop it from proliferation. And therefore, the infectious agent can easily spread and cause a cascade of meningeal inflammation, the so-called meninges. As part of the inflammatory response, what happens? You are going to produce your pro-inflammatory mediators, cytokines, and the rest. So cytokines like the interleukin-1, 6, tumor necrosis factors, of course, are going within the brain, is going to get injured. There will be increased permeability, and therefore you have a problem there. What we refer to as cytokine. Once it is highly permeable, then that is the only time that your immune system can send soldiers there to help fight the infectious agent. The BBB comes with tight junctions, and it doesn't normally allow certain substances to move in. With the presence of the inflammation, these tight junctions will open. There is increased permeability, and therefore you have now some link between immunity will recognize the extent of inflammation there. This increased permeability will then cause the movement of and even blood that will send these cells into the area to go and fight for you. So increased white blood cells with increased blood flow towards the subarachnoid space. What is going to happen? This is going to affect the cellular content of your CSF. It can even increase the volume of the CSF. Proteins that naturally won't be able to enter the meninges and form part of the CSF can now enter, because now the BBB is permeable to all those. So you realize that both the cellular content and the biochemistry of the CSF is now going to change. Now, the moment you have increased blood flow towards the brain, you are going to have increased ICP, increased intracranial pressure. This can cause constriction through mechanical input of blood vessels and even reduce blood supply to the brain and the meninges. With this, anaerobic respiration is going to occur. You have increased pressure. Every organ is pushing against every organ. Blood vessels are also going to suffer. So they are going to get vasoconstrictions or reduced lumen size due to the increased pressure within that area. With this limited supply of blood, oxygen supply to the brain and all the cells there are going to be limited, and therefore you are going to have anaerobic respiration. The end result is lactic acid production, and therefore this will affect the pH of the CSF with increasing amount of lactate. So you have the pH of the CSF being altered, lactate content being altered, and of course, with anaerobic respiration, you are going to decrease the glucose content. Blood is not coming, you are doing anaerobic respiration to reduce the glucose. So the glucose content will be altered. With increasing BBB permeability, more cells, more proteins will move towards the CSF. And this will also affect the cellular component. And therefore, at this point, when you analyze the CSF, you realize that there are changes in both cellular content and biochemical content. I take this whole thing again. The organism is in the subarachnoid space. BBB covering the brain normally would separate the brain from the periphery in terms of immune response, and therefore the organism has the chance to proliferate and cause severe inflammation. As part of the inflammation, you are releasing a lot of cytokines and chemokines. Cytokines such as interleukin-1, tumor necrosis factor, interleukin-6 as a chemotactant. All of these are produced in high amounts. This will lead to vascular injury as well as increased permeability of the BBB. Chemotactant, for example, interleukin-6, with increasing BBB permeability, will now call for more soldiers from the periphery to come to the point of inflammation. So you realize that more white blood cells, neutrophils, depending on the type of infectious agent, will now come in. The BBB is permeable now, so they can easily enter, together with other higher molecular size proteins that normally wouldn't be able to enter the BBB. So you are having increased blood flow towards the brain now. You are having increased white blood cells coming into the point of inflammation together with proteins. Eventually, you are going to have edema, increased blood flow towards the brain. So you get increased intracranial pressure. With this, the mechanical effect will put pressure on all organs, including the brain, the blood vessels. So with the blood vessels constricting, eventually you get a reduction in blood supply, oxygen supply, because all of these are supplied by the blood, and therefore anaerobic respiration will ensue. The end product of anaerobic respiration is lactate, acidic. This will alter the pH with increasing lactate concentrations. You are not supplying enough glucose and you are utilizing it through anaerobic respiration, and therefore your glucose content is going to reduce with increasing number of or increasing level of inflammation. All of these together will affect the biochemistry as well as the cellular content of the cerebrospinal fluid. So in terms of cellular content, since you are having more white blood cells coming into that area, you are going to have increased cellular content. Permeability of BBB, higher molecular weight substances like proteins also will come in, and therefore the protein content of the CSF will also increase. Reduced blood supply, reduced glucose supply. Of course, you are going to have reduced glucose concentrations within the CSF. Normally, the CSF content of glucose is about 60 to 50% of what is in the serum. You are going to get something far lower than that. This is termed hypoglycorrhea. Hypoglycorrhea. So you have reduced supply, and of course the organism too will feed on some glucose that you have supplied to the region. So reduced supply plus utilization by the infectious agent, if it is a fungi or a bacteria. Viruses don't use glucose. So normally you have viruses and bacteria feeding on their glucose, plus reduced supply due to the increased ICP. This is hypoglycorrhea. So the end result is cranial nerve, which controls hearing, can occur. You can get increased ICP that can lead to brain herniation, that may lead to death. So all of these can happen as part of the complications, together with several other neurological problems, seizures, and what have you. So that is the pathophysiology of meningitis. The infectious agent circumventing your host immunity, finding its way into the submucosa, entering the blood, passing through, and then getting to the subarachnoid space. Since the BBB separates the brain from the periphery, it is free to proliferate without any opposition, and of course, establish a case of inflammation. Cytokines like interleukins and TNF alpha, tumor necrosis factor alpha, will be released together with chemotactants like interleukin 6. The inflammation will lead to permeability of the BBB and, of course, issues with vascular endothelial injury. At times, the increasing permeability with the inflammation, then now your peripheral immunity will recognize this. There will be increased blood flow in order to send more white blood cells to go and fight for you. And with the increased permeability, you tend to have substances that naturally wouldn't be able to cross the BBB now crossing, including higher molecular weight proteins. So this is going to affect the protein content of the CSF, the cellular content of the CSF, because more white blood cells are coming in. Chemotactants that were released, interleukin 6, as part of the inflammatory mediators, is inviting them to come and fight for you. With increasing blood flow towards this area, you are going to have increased pressure there. This will lead to possibly increased ICP. The mechanical pressure itself is going to reduce the lumen of blood vessels. This eventually will reduce blood supply to this area. With this, you have reduced oxygen supply, you have reduced glucose supply, including all other nutrients. Reduce oxygen. Anaerobic respiration will ensue. Lactate, and therefore we say that in meningitis, you have cellular and biochemical changes of the CSF. Cellular changes include changes in white cell content. Even protein content is going to change. Then biochemistry include the pH change, glucose concentration changing. This can even be utilized as part of the diagnosis of meningitis, CSF analysis. Apart from confirming the presence of the infectious agent, changes in CSF content through their biochemical content and cellular content can also help us guess and find out whether it's of an infectious cause due to bacteria or fungi or viruses. But when all these cascade of inflammatory response is ongoing, if you don't intervene, then what happens is that you are going to get a lot of distractions. And therefore, it is important that you quickly detect this presence through at least the signs and symptoms, and then manage if it's a bacterial infection or fungal infection or viral infection, the appropriate chemotherapeutic agent to be able to halt the inflammation so that you don't damage so many things. If not, complications like hearing loss, you can't hear anything again because nerves or neurons like the eighth craniation that can lead to fatality, and several other CNS abnormalities. Any queries? Any queries? Class captain.
None, please.
All right. So these are some of the virulent factors for the agent. So the bacteria or the fungus or whatever should have means of attachment to the mucosal surface of, for example, the nasopharynx, and have the capacity to dodge phagocytes or any other host defense mechanisms. So the parasite or whatever should be able to evade immune response of the host. And then, of course, invader should have the means to invade the meninges and then get into the inner aspects. Also have the capacity to cause injury to the blood brain barrier, that is the inflammation, and of course, cause pathophysiological changes in the CSF space, including changes in the CSF proper, biochemical and cellular content, and if possible, even affect the brain and then cause maybe encephalitis, and then the resultant neurological sequelae. Now, once you get this problem, then the person will present with some signs and symptoms. There is this first three signs and symptoms collectively called the clinical triad of meningitis. These are those in red text. So once you have meningitis from an infectious origin, the one we are looking at, the person may have headache, the person may have stiffness of the neck because of the meningeal inflammation. And of course, it's an infection. So fever, this is caused by interleukin 1. So interleukin 1 was previously deemed as a pyrogen. So once you have the inflammation and interleukin 1 is released, it's going to reset your hypothalamic set point to a higher level. Therefore, you have fever. Next, once you have inflammation within your brain, it's not surprising that you get headache. So these are normally common. And the person could have what we call hemorrhagic skin rash. The person could have what we call hemorrhagic skin rash. So this may be seen on the skin of the person. And if there is excessive toxemia, the person may go into release of vasodilators, for example. Then there could be cardiovascular collapse as part of the shock. As I said, if you don't intervene, then of course, CNS abnormalities like seizures, focal cerebral signs, and at times cranial nerve palsies may occur. If still you don't intervene, then obviously at the end of the day, the person may even die. So note the clinical triad: neutral rigidity, headache, fever. It's not always true that you get all the three. At times you may get two, then plus or minus the CNS abnormalities. If you are not lucky, then of course, all the triad may occur. Photophobia, vomiting, hemorrhagic to the thigh, and then it fails to move. So you can see that with this patient, we've raised the thigh. We are trying to move the lower limb, irritation, area stiff, and is unable to move. This is what we call the Koenig sign. Then the Brzezinski sign is the person lies down, you try to move the head or the neck upwards, and automatically you get involuntary flexion of the knee and the hip. So the knee and the hip also begins to move just as you try to move the head. All these are signs of meningeal irritation or meningeal inflammation. Of course, it is only when you have inflammation of the meninges that some of these signs may occur. Any questions? Any
Can you
questions?
please take that again?
So you have Koenig's and Brzezinski sign. These are signs that confirms or shows meningeal irritation or meningeal inflammation. So the Koenig sign is, for example, the person lies down. Then you move the thigh to become 90 degrees to the hip. Then you try to also straighten the lower limb for it to also become stiffness. It's not moving. If this occurs, that is what it is referred to as the Koenig's sign. And this stiffness is due to the irritation of the meninges. Another sign is the Brudzinski sign. Once the patient lies, you try to move the head upwards. Then automatically, you have not moved anything here within the hip and the knee. But as the head moves up, or you move the head up, automatically you have the hip and the knee also moving upwards. This is another sign of meningeal irritation, and this is called the Brudzinski sign. These are signs that you can do to confirm the extent of meningitis there or not. So as part of the diagnosis, this could be very, very important when you are trying to diagnose the presence of meningitis. Please, are you okay?
Yes, please.
All right. How about infants? Normally, in infants, it could be some way. Infants may even not present with the classical signs and symptoms, but usual non-specific signs as if even it's malaria. There could even be diarrhea, normal fever, lethargic, and it means if you are not lucky, you may not even realize that it is meningitis that is happening. It is only when you have a longer period without noticing and you are treating your normal malaria and your normal diarrhea where you have extensive damage to the meninges. That is when the classical signs and symptoms or the CNS abnormalities, also called the neuro, and therefore this will happen within the late stage. And because you are treating other things, at that point, it may even be too late. So